right, that's Vance Joy on the Buzz, and look who's here. It's our friend, cosmetic surgeon, Dr. James Chan.
Yay!
Hi. Hello, Dr. Chan.
Hello. How are you?
We're a little silly today, as you can tell.
Okay, so I've saved this for weeks for you to get here. And that is the I know Mitch is real enthusiastic for this. I'm just kidding.
Oh, I am. Yeah, I've been dying to talk to him about this.
So the FDA just approved Kythera Biopharmaceuticals' new drug. It's an injectable, and they are marketing it to reduce double chin fat in adults. It's going to sell under the brand name Kybella, and it's for double chins. What they're saying that you can do is it's administered in office doctor visits that last about 15-20 minutes, and it takes up to 6 treatments. And then I guess I don't know what happens then, but they say that
Miracles.
The magic happens.
Yes. What do you know about this?
So I know very little because it was just approved and we haven't tried it. I've seen some of the studies on it.
What are you waiting for?
Well, so there are some downsides to it. One of them potentially is going to be the cost because, as you mentioned, it's going to take up to 6 treatments. I'm not sure exactly how much it's going to be per treatment right now, but when you compare that to what we currently do, which is, for most people, liposuction in that area, you may end up paying a lot more.
And just like with liposuction, I'm sorry, you have to do something to the skin in many cases, right?
Right.
So the skin just won't magically just suck back up into your throat. Darn it.
I love how intense you. Also, a few of the people from clinical trials had some nerve injuries on their faces.
Well, that's
but
perfect.
come on, most of them didn't.
Yeah.
Most of them had no
Chances
nerve injury.
are good. You'll be fine.
So when a new purported wonder drug comes on the market, what approach do you take to it? Like, do you wait until? How long do you wait before you're like, let's try it on people?
Yeah, so I think a lot of that depends on what the actual treatment is. For most of these things, we hear about them well before they get approved, at scientific meetings and things that we go to. And a lot of times we get approached to be, study sites for some of these things. So we have some knowledge of it ahead of time. But I think when you bring something on that you just have no information about, I think it's better to be conservative. And I like to wait at least a year to kind of find out what's going on and what's happening. I like to ask a lot of my friends around the country that are using it and really get a sense of how it's working before
if you ever need a test subject, I'm
in
sure
for anything.
Mitch.
Yeah, put me down no matter what it is.
Willing to do
And
it.
also, when you said you discussed it at scientific meetings, I'll tell you what Mitch envisioned. He envisioned an old church like the one in Da Vinci Code, and all of you, the scientists, are all dressed in robes.
Yes.
Got the hoods
With the
on.
hoods pulled way over their faces, and they have to manipulate some bones on a wall, and then they are allowed down into the deepest vault where all the secret information is exchanged. Is it something like that?
Not quite.
Not exactly.
It's not
But
exactly
no
like that.
robes.
there was some other stuff that we've tried in town. In fact, Dr. Workman was a guinea pig for one of the treatments. It's kind of an alternative to Botox. You guys might want to ask him the next time how he felt about it. But so we do get approached by companies to try things, and oftentimes we will. But my approach is very conservative. I want to make sure that it's something that's safe, and we always try it on our office, our friends, people before we'll introduce it to paying customers.
By the time a drug has reached FDA approval, it's been in their laboratories for 10 years probably. They've been doing tests on something. Doesn't take forever.
It does take forever. In the U.S., we're very slow to bring things on. So a lot of times these products have been out in Europe and South America where they're a lot
In
more,
Brazil, they've been out since the 50s.
Right. It's a lot more lax in those countries.
Like Latisse for scalps.
Right.
Ted's very bitter about Latisse not being used on scalps.
Yeah.
That's the
He's
miracle
picturing-
hair growing
he's
serum they
picturing
use.
this guy, the creator of Latisse, is just sitting in his mansion and up atop a big vat of Latisse, and every so often he dips
his own head in it.
Very
His
furry.
luxurious
head of hair in it, and it
Yes.
just waves it around behind him.
Right.
What do you recommend for people that have problems with a double chin?
With the double chin, some of it depends on their age, because as Mitch alluded to, you can remove the fat in patients, but if they have a lot of loose skin, you need to do something with the loose skin. For the younger patients, I like to add Ultherapy to help tighten that skin. For the older patients, they generally need a facelift. which is a face and neck lift, essentially.
And will some people find a sort of tightening relief from just Ultherapy?
Yes, you can get that. It depends on how much fat you have there.
Ultherapy is the process which it's kind of like a Clarisonic, like a face massager, except instead of bristles, it's just this smooth surface. I think, and then it zaps you like a little what do you call it?
Electric shock thingy?
Tiny electric shock or a little rubber band going ouch, ouch, and then it breaks down the collagen.
Right. So
and then slowly builds it back up.
Correct. It heats the tissue to the right temperature to get collagen formation.
Yeah. And that's kind of amazing.
It's like a Star Trek device.
Yeah, that's a fairly new thing, too.
Yeah.
Oh, someday they'll have the thing where you just wave it over a face and then the new face appears.
Yeah.
Call me when you get that, Dr.
Exactly.
Chan. I'll be there.
That's something that they'll have at the Monks meeting.
Will. Yeah.
Dr. James Chan will be appearing alongside Dr. Michael Workman and Dr. Stafford for a 3 Doctors, 1 Goal seminar where you can find out all the answer to all your questions regarding facial body plastic surgery and changing your smile as well. That's going to take place. The most recent seminar, the soonest seminar, will be on the 21st at 6:30 at River Place Hotel. To find out more about it, including the prizes that are offered and the discounts that you can get on booking plastic surgeries, go to 3doctors1goal.com. In the meantime, if you want more information about or from Dr. James Chan, go to drjameschan.com.
Do it.
He's the best.